Welcome to this edition of the First Aid Show. Now, in the previous video we looked at the Ipswich Hospital simulation suite and how it works. And what we're going to do now is have a much closer look at these mannequins and how they can help to simulate different medical conditions. So Jo, can you show us what the mannequins can actually do?
Yes, certainly. Obviously you can see that he's blinking at the moment. He can blink frequently, infrequently, or we can actually get him to close his eyes completely. Pupils, we can change the pupils out and make them ordinary size that they are, or all the way to pinpoint or blown pupils, depending on the medical condition. Moving on to his airway, you're able to use an ordinary oral airway or an eye gel, or you can actually intubate the patient as well. There is a procedure, if I show you quickly, of what you can actually do for can't intubate, can't ventilate. This is an anaesthetic emergency. And when you do can't intubate, can't ventilate, he actually brings his jaw forward and he clenches his teeth. His head will drop slightly, and this is an impossible intubation procedure position that the patient will put themselves into for various reasons. When we get to this point of a patient, there is no other course of action but to actually do a cricothyroidotomy, where you cut into the neck and you proceed with an airway there. So for an anaesthetic emergency, this one is one that they practice quite a lot. Obviously you're able to cut into his neck and do procedures on his neck. Into his chest, obviously you can see that he's breathing at the moment. He can either breathe bilaterally, or we can completely occlude one lung and he'll just have one, it's called paradoxical movement in his chest. So only one side will actually ventilate. That could either be because of a tension in the thorax, or because of you've failed to intubate him properly. So again, it's another anaesthetic procedure. You can actually feel his carotid pulses. So he's got good pulses in his necks, he's got good brachial pulse and radial pulse. He also has a femoral pulse, popliteal and pedal pulses as well. So if you have any medical procedures you're able to need to do a pulse, you can do that. He has a very, very good blood pressure as well. You can do a blood pressure through the machine or a manual blood pressure. And when you do a manual pressure, you will hear the blood pressure come in and you'll hear it disappear as well. And it's within 2 or 3 levels of what we actually program him for. We also have good bowel sounds as well. So I can give him ordinary bowel sounds, or up to no bowel sounds post-operatively, or diarrhea if you want to have that. With the chest examination, you can actually listen to his chest and hear ordinary breath sounds, all the way different medical conditions, from asthmatic wheeze to a pneumonia. And he has audible sounds on the front and at the back as well, because we also examine the back of the chest. So you would have to sit him forward and have a listen to the back too. So
taking it to the next level within hospital settings, what else can you do within putting fluids into the mannequin?
You can put fluids into him. Yes, we will simulate some cannulas for him, and depending on where you want the cannulas, at the beginning of the scenario you'll let me know. So you either have 1 cannula, 2, 3 or 4, and you will infuse fluids to him as you ordinarily would do. So if you're on the ward environment, you need to give him a litre of fluid, you give him a litre of fluid. Everything goes underneath into a little dump bag, and up to 10 litres you can give him before I have to stop the scenario, because then the bag goes bang. But other than that, you can give all types of fluids, all types of drugs. You can give him an oxygen mask, a nebulizer mask. As I said, we can intubate, we can ventilate as well. We've got an anaesthetic machine that we can set him up on and ventilate him with that as well. What you can't do is you can't give him any PEEP. So with the anaesthetic machines, we'll just turn the PEEP off and it simulates the PEEP, but you can't do that or his lungs will go bang.
Right. And you can use defibrillators, AEDs?
Yes, you can use defibrillator. He's set up for both AED or manual defibrillator. So for your first aid scenarios, the AEDs work absolutely fine. The defib that we use and the AED are both live. So all of the normal safety procedures must be adhered to, because he will shock you if you do it wrong.
So what other things can you do to make the mannequin more realistic for different scenarios?
You can catheterise him should you need to do a catheter reading, or simulate somebody who's gone into acute renal failure, acute kidney injury. So we will catheterise him. We have a catheter bag that can be filled with various colours of urine as you produce for the different scenarios. Obviously, at the moment he does look quite male, but we can actually adapt to look maybe female. We've got different coloured wigs that we're able to do, and obviously we can change the genitalia out. We do have an obstetric emergency day that we run every month where he becomes a she and she becomes pregnant. So we're able to then simulate the birthing of various different emergencies as well. So we can adapt quite nicely.
So you can use the mannequin for pretty much any high-level hospital setting.
Yes.
But also you can go right back to the basics within conventional layperson first aid.
You can even do to the extent where we have just a conversational simulation we're running at the moment, where we just want to talk to him and see how well people communicate. So you could turn everything off and just have somebody looking at you breathing, and you have that, so you can go right back to the basics.